My interest in this is because of the interaction of cancer and climate change and the whole triple planetary crisis that we're experiencing at the moment. And this seems to dominate our news cycles. We've had, this is a most recent paper looking at the increasing risk of environmental extreme weather events occurring really globally. We think of climate change as a problem of the global south, but it's a global problem. And as we move with increasing human emissions here, as we move to a hothouse Earth, we're at a kind of a juncture point in our society, as you probably are all aware. But if we think of extreme weather events in oncology, we think of them in terms of disrupting cancer care. When you disrupt cancer care, you increase cancer suffering, but it's a bit more complicated than that. So this is an example from Canada. So in Canada in June of 2023, temperatures peaked, and this is the Canadian Wildfire Information System weather map for that time. And at the June bank holiday weekend, people returning to New York faced this, where they couldn't see the Statue of Liberty. And you got a spike in asthma cases around this time, concordant with this. So this was published in September of 2023. And at the same time, this was also published in September of 2023, looking at cancer outcomes for people who had lung cancer surgery within a year of a wildfire. And these are the various time frames afterwards, and these are different stages, all very early stage, all curable lung cancer. And you can see from this, the hazard ratios, that their lung cancer outcomes were significantly worse depending on the time of the lung surgery relative to the wildfire. So these are examples of this interaction interface between pollution and cancer, and it's most commonly documented in lung cancer. And the most clearest example of this is from Taiwan. So there's two areas of Taiwan, southern Taiwan and northern Taiwan. And you can see here, as visibility declines in southern Taiwan here, lung cancer incidence increases. As visibility improves in northern Taiwan, the lung cancer incidence plateaus. So what happened here? What happened is, in southern Taiwan, they built all the factories. And in northern Taiwan, they put in a mass transport system which eliminated traffic. But these are kind of extreme events. What about daily events in cancer? Well, driving a car is a daily event. And this is a large study done from France. 100,000 teachers followed for up to 20 years. And they looked at two different models of exposure. And what they found was that 3% of breast cancer cases in France were related to fossil fuel pollution from cars. And if we just contextualize that in terms of breast cancer risk, 7% of breast cancer cases in Ireland are due to alcohol. But we don't tend to think of people driving to and from the hospital as a risk factor for breast cancer. So year data, the Environmental Protection Agency data showed that in the town of Macroom, the fossil fuel emissions fell by 50% within 1 week of the building of the Macroom traffic bypass. And you just wonder how many cases of breast cancer will we not see in Cork in the decades ahead because of the Macroom bypass there. We like to think of healthcare as privilege because we put the urgent before the important, but healthcare is number 5 in terms of emissions in healthcare, globally in terms of carbon emissions. And some of the gases we use are very dangerous. The ones in inhalers, for instance, the ones that we use in nitrous oxide that we use for laughing gas for anesthetics, because these stay in the atmosphere for longer. And a lot of what I do relates to patient travel to and from work. Also, things like procurement and supply chains to the hospital account for a significant amount of the emissions we see. So if we take global emissions from healthcare, it's about the same as the continent of Africa, which is about 500 coal-fired power plants a year. But my impact as a doctor is not just limited to that. Plastic is the signature material of our age, and because of the issue of infection control in hospitals, we use a lot of plastics. So you can see here, the plastic use globally is increasing exponentially, and about 10% of that plastic is recycled. So a lot of it is still in use, and a lot of it then is discarded. And when it's discarded, it's broken down to either microplastics or nanoplastics over variable periods of time. Willem talked about Dublin Bay. So if you throw a newspaper into Dublin Bay, it'll take about 2 weeks to disintegrate. If you throw a piece of fishing line into Dublin Bay, it'll take 600 years to disintegrate. And these microplastics are a problem because they stay in our system. With recycling, plastics tend to go into the environment rather than recycled. There are some imaginative ways of recycling plastic, and this is from Indonesia, where they looked at diapers, and on RTE this morning it said that we use 1 million disposable diapers a year in Ireland. If you stacked all the disposable diapers used in Ireland every year, it would go from here to the moon. And so in Indonesia, they have an even bigger population than Ireland, and what they've done with diapers is they shred them, and then they've integrated them into building material and with concrete, and the percentage of diaper relative to the concrete varies. So that's a retaining wall there. So you want that might be 5% diaper and 95% concrete, but this is a partition wall, so that might be 20% diaper and 80% concrete. And they've used this to decarbonize their building environment, and it's also a really imaginative way of addressing a problem. But for the plastic that's not in the buildings in Indonesia, it enters our ecosystem. So we have it in our water system, both salt and fresh water, and we have it terrestrially also. And these microplastics relative to bigger plastics are a problem because they tend to bind pathogenic organisms more favorably, and that has an additive effect in terms of health because you get a negative microbiome and a toxic plastosome. And so these plastics are in our environment, and we eat them in our food, we ingest them and inhale them in our systems, and we also absorb them through our skin. So if we take about, if you're someone of my age in this audience, which is you're not many of you are my age in the audience, but for those of you that are, 75% of us have microplastics in our bloodstream, and some of these are forever chemicals. We'll never be able to get rid of them in our lifetime, or probably in our children's lifetime either. And plastic is really the gift that keeps giving in terms of healthcare. So we see multiple health issues in terms of the fossil fuel extraction, which is a seed material for plastic, in terms of coal mining and oil and gas, and in terms of production. And of course, a bit like plastics, like climate change, and this is also seen, we have put the factories into fence-line communities. So we see increased risk of leukemia, for instance, in children growing up in these communities. And then in terms of our recycling and waste disposal, and also just in terms of direct toxicity in our environment also. So how does this work? Well, it works. These microplastics are ingested. In terms of human effects, we see them in cardiovascular plaque, we see them in lung, we see them in increased risk of infertility in terms of reduced sperm count, and also in terms of miscarriage rates. And in oncology, microplastics activate pathways that initiate genotoxicity, and genotoxicity is associated with cancer development. What I do, my carbon footprint is evolving even more, and we talk into the promise of artificial intelligence in medicine, which is enormous benefits. So Willem talked about antimicrobial resistance. So this is a paper that came out showing that the destruction of antimicrobial resistant organisms by viruses that are generated by artificial intelligence. And we also think about artificial intelligence in terms of health prediction. So this is the development of a digital twin. So they have this database of 500,000 people in England, and they joined the database at age 40, which is why nobody died before the age of 40, because you had to be alive to get into the database. And what they looked then is that they tracked people's illness over time. And so what this will allow you to do, so say you develop breast cancer at age 45, and then you have a heart event, say at 52, well, your digital twin will tell you that your next major health event will occur at this age, and it will be this. So you could say, well, I'm under 40, so this is irrelevant to me. So the next plan they have is to take 54 million health records in the UK NHS and put them into the development of a digital twin for the UK population. So it's an enormous potential, as you can see, in terms of healthcare, but it's not without its cost. So in the artificial intelligence in our data centers, 30% of the data in our data centers is healthcare-related data. And so by 2030, 10% of Ireland's electricity consumption would be storage of healthcare data in data centers. These data centers are getting bigger. The largest announced will have electricity consumption of millions of households. There's two ones called Hyperion and Prometheus, which are being developed by Meta in the United States. Each of them has the size of the island of Manhattan. And the chips in these reach the temperature of the surface of the sun, and they require fresh water to cool them. So depending on who you read, if you read the University of California in Riverside, they say you need half a litre of water to cool is needed for a ChatGPT calculation. Sam Altman, when he talks about it, says it's about a teaspoon of water. So the truth is probably somewhere in between, but the truth is kind of sobering. Amazon aren't building data centers in Ireland anymore because our water infrastructure isn't adequate to deal with them. So with all of this going on, what if we do nothing? Because this seems like a huge problem in terms of emissions in healthcare. We do look after patients. Patient numbers are increasing. Our healthcare system is always in crisis, it seems. And so if we do nothing, then by 2050, healthcare-related emissions will have tripled. So it's 1,500 coal plants, 3 continents rather than 1 in 500 coal plants. So we can't ignore the problem. So how do we mitigate this? So there's a movement in healthcare, green healthcare, and what we do is we build sustainability trees of solutions looking at things like a revaluation, reduce, reuse, recycle. A lot of the time, 20% of what I do is wasteful, 70% of it is impactful, and 10% of it is harmful. And each of these metrics are modifiable. And often less care is actually better care because you think more about making it easier for the patient to travel so that their emissions are less, so they give them treatment at home. You do a telemedicine visit with them rather than have them come to the hospital. In an ideal world, we would be like the labs. So this is my green lab, which was brought into Ireland by Una Fitzgerald in Galway. And Ireland has the highest percentage of migraine labs per universities in the world because of her action. So it's the power of an individual. And if you work in a migraine lab, you get a readout of all of your printouts of all of your waste, animal waste, electronic waste, and it allows you to measure what you do. And it'd be lovely in healthcare if we had the same thing, what percentage your emissions for travel to care, so that we could modify and adjust it. In our team, we liaised with a group in the Netherlands who had looked at trying to reduce plastic waste by looking at oral medications rather than IV. So if I give a tablet, oral Panadol, it has a carbon emissions that's 50 times less than IV Panadol, but it's equally effective. If I give oral chemotherapy, it has a much lower carbon footprint also and less plastic. So this is a dashboard for a screensaver for an oncology day ward. And so it looks something like this.
I'm a medical oncologist.
So anyway, that was so ignore that. So anyway, go back. So I'm going to go back to the one here. There's no audio on this one. So anyway, what we do is integrate sustainability statements into protocol, use more telemedicine. And I want to draw your attention to lifestyle and exercise prescriptions here. But by doing this, we're hoping to prompt people to prescribe less, prescribe more wisely, but also to prescribe in a different way that's more environmentally friendly. The next slide is the pitch I had for the Spark Award, which they've given us for this to implement it into an oncology day ward. And we've in the paper here we've translated it into 7 different languages, including the Dutch, the ones of our Dutch collaborators, to make it less Anglo-centric and make it more because this is a global problem. It isn't just an Irish problem. Why did we introduce lifestyle into what we do? Because a significant proportion of our emissions, 25% of our emissions, are related to diet. And the impact of this is shown here. So the band Massive Attack did a concert in Bristol Downs. 30,000 people turned up at the concert. And so they partnered with the Tyndall Institute in University of Manchester. Tyndall was from Carlow, and he identified that it was identified beforehand that the Earth was too near the sun, and he identified that the reason the Earth could be near the sun was the atmosphere, and so we're destroying that atmosphere now. and that's why the planet is overheating. And with this collaboration, what they did was they wanted to reduce the emissions from the concert. So the things that you think about, blue is what would be life as normal, and then brown is what they achieved in terms of electricity reduction, in terms of fuel and artist travel. But look at food here, dramatic reduction. And that's because they reduced red meat, white meat, and vegetarian to just vegan only. So dramatic reduction in this. But it isn't just the carbon emissions, there's also health benefits. So this is a study assimilating over 3 million people looking at planetary health diet integration into your life. And what you see is a significant reduction in cancer mortality. So this has patient benefits and also planetary benefits as well. You could say, well, it was 98%. Why wasn't it 100%? So where was the 2%? So the 2% of emissions, 60% of the 2% of emissions were from the 5% of people who flew to the venue and wouldn't take public transport. So there's kind of a message there. The other trial that I thought was really interesting in my final minutes is this trial. It's called the Perth trial from Western Australia. So we recognize that microplastics are a problem and they're everywhere, including in placenta. And so what they did here was they identified people at cardiovascular risk because we see microplastics associated with cardiovascular disease, and they randomized them to standard of care life and then a life without microplastics. So they looked at everything. They looked at washing up liquid. They looked at toothpaste. They looked at the toothbrush you had. And they took the people over a 2-week period and they measured microplastics at the beginning, in the middle, and the end. And this is their initial paper outlining their plan. So I think this is a fascinating one because I think it's the first time I've seen an intervention to reduce microplastics as a public health measure. So how do we bring all of this together? Well, in Ireland, as an oncologist, the biggest thing that has made a difference to my life is the cancer strategy. There have been 3 of them, and they've made us bottom of the class to middle of the class in cancer outcomes in Ireland. So they've been transformative in the lifetime of everybody in this room. The next one is due in 2027. So we assembled a coalition of the interested, some of whom are here, to look at climate adaptation that was discussed earlier in terms of our building, and then things like climate mitigation, cancer prevention and cancer research, how we can integrate and cascade climate sustainability into our research and then into our clinics. But we hope to leverage the next cancer strategy as a way of leapfrogging the integration of sustainability into cancer care in Ireland, because if we don't do that, we'll just keep going as we are, and our 2050 reality will be what the Arab document showed earlier. This is just to advertise a webinar that we're doing in part of London Global Cancer Week, where we're having testimonies from people who were impacted by climate change. This guy's practice was eliminated by Hurricane Helene in Florida, and then ambassadors for climate engagement in healthcare talking about what they're doing, and it's free to register, and we will be promoting it through our networks, and I'll send a copy to your group also. And this is my last slide, and thank you very much for listening to me today and for inviting me to speak. I was very honoured to be asked.